have any ear problems, you'll start with me, Kristen, the audiologist. The first step is checking in with Alyssa here at the desk, and then you'll have a seat out in the waiting room. I'll then come grab you, and then we'll head to our audio room. Inside the audio room, essentially we're going to get a case history, so we're going to ask you what's bringing you in, what are your symptoms. I'm also going to take a peek in your ears to make sure that everything is clear, that the eardrum looks normal, and that there isn't any debris or a bunch of wax or anything. So we'll come inside here, you'll essentially sit down. Again, we'll continue the conversation of what's bringing you in. We'll take a peek in your ears, get all the information that we need, and then we'll put you right inside the booth. So sit in this chair right here. I'll get you all hooked up. There's two different types of headphones. So we have headphones that fit down into your ear. Essentially, it looks like earplugs, so those will fit down into your ear canals. Or we'll use a headphone like this, more typical of just over the ears. You'll hear a series of sounds, and you'll just push a button. Whenever you hear that beep, we're going to try to find the softest level at which you can hear in both of your ears. Once you're finished with me, I'll let you know the results today of your hearing test, and I'll walk you right back out to the waiting room. If you're going to see the provider as well, the next step would be that the nurses would then come get you to then see the provider.